Hi, Jill. Thank you so much for taking the time out today for our audience. And me, I really appreciate it. How are you doing today?
I'm great. Thank you so much for having me. I'm
Yeah,
excited to be here.
yeah, the pleasure is mine. You taking the time out today, and we're gonna discuss something is really, really important. Just like one of the worst nightmare for families and people like we go through, which is like a cancer. And not oftentimes we talk about it and we try to hide it, right? So even though someone's got cancer or the family members around there, we always try to avoid the conversation and like cheer them up the patient, which is fine in a way. Then we need to speak if it's like a health professional, like is a doctor, nurse, or someone really actually need to explain to them what's actually happening to the person or like the patient. So today we're going to discuss that and we're going to learn from you how you help other individual patient understanding what's going on with their body and the illnesses. So before we get into like all of them on today's topic, I'd love to know more about you, how you go into like being a nurse and helping. How did you choose your career? Is that something you always wanted to do, helping others, or like you just suddenly just happened to be one of the nurses?
Yeah. So yes, I didn't just happen into it. Um,
Mhm.
I even now, like looking back, it's kind of like the hindsight's 2020. Like
Yeah,
I've been a nurse before I was even nursing, is what I've realized when I kind of look back growing up, even as young as age 8.
yeah,
I distinctly remember, being on a vacation and seeing this caterpillar that was actually getting kind of, sounds gross, but getting eaten alive by some bees. And I was crushed. Like I couldn't leave this, I'm 8 years old. I'm probably second
yeah,
or third grade. And so I was compelled to stay there and just be present with this
mm,
caterpillar. I mean, that sounds so silly, but it's like I didn't feel like this is a living thing. It should be
yeah,
alone while it's suffering. And so, looking back years later, I'm like, man, I was even nursing when I was 8. And so that's kind of always the way I've operated from. It's always been about helping others, and um, service is by far one of my highest values. And so nursing was absolutely, the perfect fit.
yeah. That's great. So like, did you choose to be like a cancer nurse, when you actually chose your like education or something, or like later after like being in a nurse for a year or two, like and then you decided to being like a go to like a different department, like as in a cancer nurse?
Yeah. I can tell you that when, the second most frequent question anybody
Mm.
asks you besides your name is, what do you do?
Yeah.
And I have pretty much, cornered the market on conversation killing as soon as I say that I'm a cancer nurse, because everybody's like, oh, I'm so sorry. So I have to really say, it's by choice. Like I've been
Yeah.
doing this for almost 25 years now, and it's definitely by choice. And so you're right. I think, again, here comes that personal experience where the first time that cancer kind of came into my life is when I was in 6th grade, and my grandpa was diagnosed with prostate cancer. And so over the years, I've had a number of family members who have been diagnosed, but really what kind of stuck for me, and that's probably also why I'm so passionate about explaining cancer simply and having these conversations like you alluded to in the beginning
Yeah.
of, kind of talking about the elephant in the room, because that's not what happened for me when I was a kid. And it was the hardest thing to not be able to talk about it, ask questions. And so, I just felt even then, and I was, 6th grade, he passed away when I was a junior in high school. But all the while, I just kept thinking, it doesn't have to be this hard, right? Like,
Mhm.
it doesn't have to be like this. There can be a better way that, family members can actually support each other and get support and feel, better about what's happening. Just understanding what's happening is half of, really is half of it.
Yeah.
So I've been in oncology my entire career. That was my first nursing job. That when I interviewed, I was specifically looking for a cancer position. And so I've
Right.
worked inpatient and outpatient. I've done all the things, clinical trials, but it's been cancer has been my thing for 25 years.
That's great. 25 years is a long time, like over 2 decades, nearly
It
getting
is,
to
yeah.
right?
That
Yeah.
makes me sound old.
No, it didn't look to be old, but thing is like the experience you had like over the years, and you can probably seen like the changes happen over the years. Like when you first came to like being in the zone, like
Yes.
being a cancer nurse, the treatment we have right now, it probably wasn't there back then, and it was like probably stressful. Like probably death rate was more higher than compared to right now, isn't it?
Oh, 100%. I mean, and even, like you said, we talked about like the nausea medicines, that what we
Yeah.
can do, the symptoms and that we can help avoid
Mm,
weren't there. They weren't options when I started, nursing. And so, I always have that conversation. There's a lot of course, as you can imagine, fears
yeah.
about even just hearing the C word. Once you've been told that you have the C word, pretty much the world stops and you go into shock. And so most people go into, very quickly the rabbit hole of worst case scenario and imagining all these things in our mind. And so, a lot of that is in the beginning is me helping people manage what those expectations are. And I'm like,
Mm,
well, you're not going to be, you shouldn't be, hugging a toilet, puking your guts up 24/7. And they're
yeah.
like, I'm not. And I'm like, no, no, that's not, that's there's a reason why they call it drama in a
Mm.
TV or a movie. It's intentionally that way, but that's not actually what it should be like in real life. And if it is, we need to know, because there's a lot of things we can do about it.
Yeah. So like when did you actually decide it like people need to aware of the like they need to know in terms of like what's going on to them, and you seen that like there is a problem like people not understanding what's going on to them. Probably they don't have the kind of severe stage they're in. They're probably on a stage one, stage two. There's different level of cancer. Some of them on a stage four, like a very limited time they have in their hands. So when do you actually come across with like people need to understand more about what's going on to their body rather than just ignoring that fact and go to the reality, right? You can't just ignore it like what's going on to them. You have to
Right.
explain to them. So when did you actually realize, no, I need to explain to them, and you decided to being in the podcast platforms so people can be more aware of like, I need to get to like a cancer nurse or ask a doctor or something more about like what's going on to me. So when it actually happened to you, when you realize like I need to spread the information to other people.
Yeah. I think some of that has been just in my years of experience of hearing patients. I've heard patients who were 3 months into their treatment and
Mm,
they, finally kind of in a teary, way, they kind of admit that they don't really understand what's happening to them. And so
right.
just as I've been, working with patients and you can imagine in 25 years, I've worked with thousands of patients, but
Yeah.
just continuing hearing story after story. If I was speaking at a patient support group and somebody who was completely finished with treatment was coming to my Cancer 101 talks and
Mm,
asking questions. And I'm like, okay, why are, and coming up after me afterwards to tell me that they, really learned a lot. And so my initial, impression is, oh, have you been, diagnosed recently? And they're like, no, I'm totally done. I've been done for a year. And so
yeah.
it was really shocking to me to hear that people had gone through, months of, being diagnosed and treated, and they still didn't really understand what happened to them, what their diagnosis means, why they were getting the treatment they were. And so the struggle that I found is like, how can they do well if they don't know what's happening and when to call the doctor, or when to, what to do at home to help them get through this. And so it really came down to just, I mean, it's a big issue of this medical jargon all the time and how we talk and talk with
Yeah.
patients. And so it doesn't, I know that cancer is really complicated. It seems complex, but it still can be explained simply. And
Mm,
that's why I think a lot of conversations at home don't happen, is because they either don't understand it themselves enough to talk about it,
yeah.
or they don't know how to explain it simply, for example, to their kids or their grandkids. So those conversations never happen. And it just really ends up leaving people feeling incredibly isolated, and it really contributes to the anxiety and all the stress and the worry, and all that impacts how well they do and how they
Yeah.
feel. So I think it's incredibly important for people just to, and really a basic right to understand what's happening to them, what to expect, and how they can do their part to give them get them back to health and wellness as soon as possible.
Yeah. So isn't that something like a provide by like a health services like a hospital or anything like that in US? Could be different in the UK. I'm not 100% sure.
Yeah, I mean, I think most patients, the trick is that it's not that they're, doctors and nurses aren't already, it's not that they're not educating patients.
Mm.
They are. The problem is they're doing it with using a lot of medical terms,
Yeah.
and they're doing it when they're in shock. And so,
Right.
when there's a really horrific stat out there that most patients remember or forget. Up to 80% of what's told to them in their first doctor's appointment for like when they see the oncologist. So
Right.
if you can imagine you not remembering 80% of what was told to you when you just, were diagnosed with this serious illness. And that's really when they talk about the diagnosis and the treatment and what the plan is, and you're expected to make all these decisions, major decisions. And what they do remember, 50% of it, they remember incorrectly. And so again, how can you make good decisions if you don't really understand what's happening? So I think it's really important to, one, rethink how we help patients understand. Stories are an incredibly powerful way, using analogies and metaphors, putting that really complicated information into in a simplified story or an analogy that makes sense to them. Right. So for example, I talk about, when I talk to people about bone marrow, that's not a normal everyday conversation. But when I talk about it just being a cell factory, most people can imagine what a factory is and what, happens on factory lines. And so just using simple analogies really can make a huge difference, in them understanding what it is, and then they know what to do. It helps them, ask better questions for their team as well.
Yeah, so that's like a great decision you have made in order to like educating them, like what's actually going through their body, like probably their report, their X-rays, or wherever there is like MRI scan. It's a different kind of cancer. Is a different way like you can actually catch them and obviously treat them. And also like there is a treatment plan you need to explain to them. Some chemotherapy, right. There are other kind of medication you need in order to do that. Like I remember like my dad had a lung cancer when I was like 11 years old. So obviously I was with him all the time, like when going through like medication and everything. So it's a different stage of different kind of medication you have to go through. And in terms of like a doctor, the analogy they use, the word they use is not like understandable for like a normal human being, like what type of, like a chemotherapy, like why is a chemotherapy if you never had a cancer or none of your family member had it before. And most of the doctor is so busy, they don't have the time to explain to you like what is chemotherapy, how is it done, what kind of risk factor is there, like every treatment has like some kind of side effects. Absolutely. Either it's medication or even there's a small thing as a paracetamol. If you're having it too much, there is side effects to it. So in terms of like what are you actually doing in terms of like making people aware of their condition and everything? Are you actually helping them in a way in like in your hospital, or like doing like a private consultation, or like helping them? So how people can get the benefit from it?
Yeah. So I am actually a nursepreneur. I'm a nurse entrepreneur is what I call that. Because what I discovered was after years of trying to essentially fix this in the system, it became pretty clear that it wasn't gonna happen. And really where patients need it most is when they're less stressed out, and that typically means at home, right? So I do work as a strategic advisor for an oncology startup platform that we are working to bring this, kind of thing to, in masses to people so that they have access to it. But even right now, I do a lot of videos and a lot of education type of stuff for people so that they can get to that information and just understand little bits and pieces. And that's what I found is video is probably the best medium that I have found in order to explain things, because it feels, one, more personal, and two, it's much easier to listen to something then try to read it, right? To read
Right.
paragraph and paragraph. And it's like, there's no shortage of cancer information out there, right? There are lots and lots of nonprofit organizations, and they've all got, just pages and pages of cancer information. Yet I kept seeing the same thing is over and over again, is that patients, people didn't understand what was happening. And so, yes, I do work one-on-one with individuals. I'm seeing a lot, I don't know what's happening in the UK, but in the US, we're seeing more and more people who are literally finding out that they have cancer and getting their pathology reports in their email. Like, it's being uploaded to their electronic medical record, which is a whole nother topic. But, that immediately sends them, of course, into panic and to Google, right? They're going to chat rooms trying to figure out, what do these words mean? What does this mean? What does this mean? Just like you said, they can't tell because it's not written for them, nor would they possibly understand what the difference between stage 3 versus stage 1, or, they can't tell that by looking at a report. So I'm doing more and more of that, of just helping people walk through, okay, what are these results mean? And actually, what does it mean for me? And then helping them, with questions of, okay, you're going to see the doctor. Here's a list of questions to consider asking, right? To help them be more prepared for that appointment. And it's just really what I'm seeing is it's taking kind of a lot of the shock and I can't eliminate the fact that you have been diagnosed, but I can help you understand what's happening. And to me, after seeing, so many family members and years of helping patients, like, that's the least that we can do is help people understand what's happening to their body, so that they can, what their choices are. And they do all have choices, right? And so that they can make the best decision for themselves, and then support them, as they're going through whatever that treatment is, whatever that looks like. But how do they get back to trusting their body? How do they get back to not constantly being, thinking that every, pain, every twitch, every whatever means that the cancer is back? So there's a lot of emotional and psychological support, really, just getting in the right frame of mind so that you're not consumed by a diagnosis. You are much more than just a diagnosis. You're a person who happens to be dealing with this specific thing right now. It's part of your story, but it's not the entire, it's not all of it. It's a single chapter. And so the goal is to help you through that as best as possible.
Yeah. So I have like a question for you. So those who's listening to our audience probably mostly from like the US and UK. So UK is like, it could be different than, I think, US. There is a lot of support in UK because we have like a great NHS and everything. But even though they don't have like a kind of support, and especially for like a US audiences, if someone on their family or themselves never know in future they have cancer or already got the cancer, and they're going through like the same process like you mentioned, they don't know like how to get some kind of help or like understand like what kind of steps they need to do in order to get like a proper treatment, what stage they're in, and understanding what's actually happening to them, who can explain to them. So what's the best way for them to go about and get some help, like from cancer nurse yourself, or like other individual, probably they're in a different state or different area. So what's the best place they can reach out for like advice or guidance?
Sure. They can certainly reach out to me directly, and I can, help either connect them with resources that I have, or, point them at least into the right direction. I'm constantly adding new resources, that are available to patients and family members as well. And I created kind of a video series. It's called the Cancer Healing Partner Series. And that's, again, just these little, small 5-10 minute videos of very specific pieces so they can understand as they're going along. And that's what I've seen between helping explain it simply and really like knowing what to ask. You know, when I was sitting next to my dad and the oncologist when he was being diagnosed with a rare blood cancer, you know, the doctor was very personable and he really liked her a lot. She kept asking, you know, do you have any questions? Do you have any questions? And, you know, he said, finally, he's like, I wouldn't know what to ask. And that's true for most people. They simply don't know what they don't know. And so to have someone who, you know, essentially, I mean, the only point is to educate and support. That's it. Like I have no other, I'm not tied to a specific doctor or a specific hospital system. It's just to help you feel better about going into that appointment and being able to ask good questions so that you can make those best decisions for yourself. So, you know, people can connect with me on nurseassure.com is my website.
Right.
And yeah, and they can email me or connect with me there. And I'm happy to help point them, you know, again, in some direction of some, you know, resources that can help them kind of as they're going along. Even, you know, like I get the question all the time, how do I talk to my kids about this? And so that's personal to me because I'm, you know, right back to when I was in 6th grade thinking about, you know, all the questions that I had. And so just some tips to, you know, start those conversations and things that you can do to help your kids feel, you know, comfortable, you know, that it's okay to ask questions. Yeah,
that's great. So like those who like from different area, not close to yourself, can they get help like being like over the video call or something like that, maybe virtually?
Sure. And in fact, I mean, 99.8% of what I do is virtual because, you know, I mean, between all the time with the pandemic, which certainly increased a lot of, I mean, it just poured gasoline on the fire of need, quite frankly, because most clinics shut down. And so they were not even letting spouses sometimes come in. And I'm like, what are you talking about? Like, you can't, you know, you can't do that. You can't bring somebody in who is in shock by themselves and expect them to understand what's happening. So tips like, okay, ask to record the session on your, you know, you can ask to record on your voice recorder on your phone, the session so that you can hear it again when you get home. And so you're, you know, giving them a list of questions to ask when they're there. But it's only exacerbated the need for sure. So yes, absolutely. I do a lot of work online through, you know, conferences, calls like Zoom or, you know, messaging and stuff like that too.
Yeah, that's great. So thank you so much, Jill, for sharing the valuable lesson today. We're running out of time for this podcast episode. So yeah, it is a great, and you shared your social media platform and also like your website, how people can go reach out. And I'm also going to leave the link on the end of the bottom of the podcast link. So if anyone wants to work with you or reach out to you, get some advice, they can do that also. So I wish you best of luck with your career and you have like a wonderful year.
Thank you.
And I really appreciate you coming today and sharing your valuable lesson.
Yeah, thank you so much. And I appreciate you having me. And I think the last kind of message is just to, if you have or someone that, you know, has been diagnosed with cancer, don't be afraid to ask questions. You absolutely can understand what's happening to you. And if you don't know, that should be, kind of a red flag of finding someone who can help you understand.
Yeah, I really appreciate that. So thank you, Jill, and thanks for your time. So yeah, that's a wrap, guys. Thank you so much for listening to this podcast episode. I really appreciate it. So if anyone wants to reach out to Jill, go check our website and social media platform, and you can work with her. So until then, stay safe, stay healthy. I'll talk to you in the next episode. Thank you.